Guest introductions. So yes, we are recording. So we can give this meeting to members who aren't able to make it. So welcome to our monthly virtual luncheon for August. My name is Steve Morris. I'm the current club president. The days are ticking though, as we change over at the end of September. So I have 2 months in my lame duck presidency, and I will try not to cause any stock market crashes or any kind of ruffles in my final few months here. So welcome guests. The Tierra Santa Club just went around and introduced themselves. I think we've got 5 members from that club, so thank you for being here in support of the Kiwanis movement across San Diego. Do we have any other guests? I know we have some speakers here, and so they'll get introduced in a moment. But looking at the list, I don't believe we have any other non-Kiwanians on the call, unless, okay, Judith's telling me no. And there's a nice picture of Drew and Doug, and there they go. All right. So we like to get right down to business on our virtual luncheon. So if you're eating lunch, not virtually, literally, then you can turn off your camera during the presentation because we don't need to see you eating. But it's my pleasure to have one of our most esteemed members, Jay Jeffcoat, introduce our speaker today from 211 San Diego. So take it away, Jay.
Thank you. Well, I tell you, it is a super pleasure for me to introduce today's 211 speaker, Paul Redfern. It is ironic that I have a coincidental background with 211. I served for 8 years, 100 years ago, on the United Way board, and was on the executive committee when a choice was being made to divest United Way of its volunteer center and InfoLine, which were non-fundraising wings of United Way. I voted against that divestment because I actually served on one of those committees, loved what they did for United Way, but was in the minority. But I remained very close to the Volunteer Center and InfoLine. In 2000, the federal government created, through the Federal Communication Commission, created the 211. And Sarah, who had been the director of InfoLine at United Way, asked if I had any contact with Greg Cox, the chair of the Board of Supervisors. I said, well, yeah, he's a good civic friend of mine. And so we set up a meeting with one of our United Way board members, with Sarah and Greg in his office, and told him about the fact that this had already been in existence for 3 years around the country, and it'd be a wonderful thing to start in San Diego. Greg jumped on that, became the mover to get 211 going forward. And it was really, a tremendous success. I personally benefited from it when we lost all of our earthly possessions in the wildfire in Rancho Bernardo, because the 211 was available to help literally thousands of people. So now I get a chance to introduce Paul, a CPA, public accounting, specializing in management accounting, business accounting, and auditing. He also had a background to being a chief financial officer of a very successful web hosting company. He holds a bachelor's degree of science from, I believe it's from Hook'em Horns, University of Texas. And he has an award in accounting from my law school alma mater, UCLA. He serves as the treasurer of his own church. He is the board member of the ECHE YMCA in Encinitas and the Community Resource Center in Encinitas. Ladies and gentlemen, we're honored to have Paul Redfern.
Well, thank you, Jay, and thank you, Kiwanis Club. It's an honor to be here, to be able to share with you a little bit about where 211 has been since Jay and who we call our godfather, Greg Cox, Supervisor Greg Cox, helped establish this line back in 2004 in San Diego County. Just quickly before I share my screen, it's always interesting to get a bit of a read of the room, maybe through the raise your hand icon at the bottom. Have you guys all familiar with 211? Have you heard of 211, or have you interacted with 211? All right, good. Looks like we're at least in the know a little bit about the 211 organization. So let me share my screen. Everybody able to see that? Great, thank you. Yeah, so want to go over a few things today. I will cover very, very briefly, I think what Jay was shared very eloquently about 211 in general, but I want to spend a little bit more time on what is 211 San Diego, as they do differ from county to county. And then really move into the meat of the conversation around how do people access resources in our community using 211 and what 211 has become. And I want to share a bit of the evolution that the organization has gone through since I've been here for working with 211 for about 14 years. And then the last piece, really, how do we present ourselves in the community and public to make sure that people are fully aware of, you know, who we are and how we can work in order for people to secure those resources that do exist in the community. If there's a comment or question anytime, please feel free to unmute yourself and jump in. I'm more than happy to elaborate on anything that might be interesting that needs further clarification. So getting right into it, what is 211? Jay's absolutely right. Back in 2000, and really took a lot of momentum post 9/11 2001. There was a need for one easy to remember dialing code for people in communities to access the resources that were available to them. You know, very much like back, some of us used the 411 dialing code. You know, city and listing, please. You would say, I need to speak to the cab company, and they would give you a phone number that you could call. People that are looking for resources in a community don't know what to ask for. A lot of cases, they don't know where to turn. And so it can be very confusing, or it has been very confusing in the past. When people wanted to access resource, they knew that they had a need, but they didn't know which organization could help them. They didn't know what resources existed in the community. 211 became that centralized phone number that people could utilize in order to be connected to the applicable resources that could impact and help their living situations. Across the United States and counties everywhere, there are nonprofit organizations, there are government entities, and in some cases there are for-profit companies that can assist people that are in need. These go beyond food, they go beyond housing resources, they get elder and dependent care, they certainly work with children and children's resources, they can do disaster information, but there's myriad resources that are available. Digital literacy and internet access is one that we're working on currently in San Diego County to make sure that the young people in our community that are going to school are connected to the internet so that it can access information that other students are able to. Utility assistance. There was an article in the Wall Street Journal about utility prices today in California. It's an area where we assist our neighbors in accessing utility subsidies and other utility resources. There's specialty programs, there's veterans programs. There are nonprofits of every stripe and every flavor that exist across the nation. And 211's responsibility is really to make sure that there's a centralized resource database that has the listings and the resources that are available, and then connecting callers to those resources that exist in the community. So that's the overarching 211 everywhere. About 80% of our country is covered by a 211, and that's geographically. Population-wise, almost the entire population is covered. Where we have some drop-off in coverage would really be in those rural places, you know, kind of that last mile idea almost, if you will. There's also 211s in Canada. We have a consulting contract with 211 Ontario, but there's other three-digit dialing codes that are around the world. So some of you who've traveled outside the country might know that, you know, 911 in other parts of the world sometimes is 999. In other parts of the world, instead of having a 211, there's a 222. And so this is an idea that was started in the United States in Atlanta and has really grown across the globe, and pretty excited about how it's worked and how it's improved over time. So that's the broad scope. Just getting into what is 211 San Diego, and Jay was absolutely right. We started as a department or a resource within United Way San Diego. It used to be literal copper line, phone sitting on a desk in a phone book. Some of you might remember phone books. it wasn't a yellow pages, but it was a specific resource directory, and people would call in an anonymous call. A person on the other end, lick the finger, open the resource database. We still have copies of them downstairs if anybody wants to stop by and see them. But it would list what the resources were. Of course, now we moved on to digital, but that Info Line of San Diego, which is our legal name, we removed out into our own 501c3 charity. That was prior to the 211 dialing code. And then Jay, as he mentioned, Supervisor Greg Cox, the existing leadership at 211 at the time, applied for that Public Utility Commission designation of that 211 number for our nonprofit Info Line of San Diego. We successfully secured it, and Supervisor Greg Cox made the first call to 211 in San Diego on February 11th, 2004. February 11th, significantly because that date is 211. So, as I mentioned, 211 San Diego, we're a nonprofit organization, and the core service, the core thing for all 211s is connecting people to those resources. It started with community resources, but more and more it's going into the healthcare space, really along the lines of social determinants of health. We have recently become the parent organization of San Diego Health Connect, which is our health information exchange. We do not share health information into 211 at this time because of HIPAA laws, but we are looking at ways that we can find the social determinants of health that might be recognized by a clinician at a hospital to make sure that those referrals are being made to appropriate nonprofit organizations. So we're expanding that reach in ways that we can connect people to services. That is our mission, is to connect people seamlessly, not just to connect them, but to remove those barriers that people frequently face when they're trying to access resources that do exist. And then to work with our community and partners in the community on different ways to either eliminate barriers that exist, be it for lack of transportation, or be it because of where resources aren't. But how can we improve the system overall? And we're going to start going into how we've evolved into that role in a couple slides. We do serve San Diego County primarily, but we also have the designation for Imperial County, which is very different, both population-wise, geographically, and as far as nonprofit resources are concerned. We answer calls, obviously, around the clock on the 211 line, and we can answer the calls in almost any language. We have a language line. Most of our staff are bilingual. We both speak Spanish and English, but we can answer calls in any language from around the globe using our language line, and we frequently do. It's very interesting to see the demographics and to see that language line bill come in the mail to see which languages are being utilized by our community that we exist in. And then, as you'd expect, the computer and the internet is becoming more and more of a tool all the time. There are more technological tools that exist. The phone and having a call with a person, a human being on the other end of the phone line is becoming, it hasn't really impacted 211, but I'm sure that we've all seen it in our lives as we use apps or we use the internet to access information rather than speaking to somebody directly. We do have our full resource database, which is searchable online. We are seeing upticks in people utilizing that as a trusted resource to kind of self-direct. In the future, we will be moving to our own app, probably with the integration of some of the things that we see. I just skipped ahead. That we see with San Diego Health Connect. So how can we integrate those and authorizations as we move forward? So continuing to leverage technology. We do have a role, just to touch on, our day-to-day, we're connecting people to resources. We have the additional requirement that during disasters, we assist our community as the non-emergency phone line to call. Prior to 211, in the first, large fire, 2003, in the East County, 911 actually crashed because they were overwhelmed with calls. Flash forward to 2007 fires, 211 did exist, and that was a major turning point for our organization as we started to receive the phone calls for family reunification sites, evacuation routes, evacuation orders, shelters, food resources, local area assistance centers. We were able to decompress that 911 line by answering the 211 line for those non-emergency calls. I was here during the 2017 fires in Fallbrook. As you may recall, that fire really impacted a mobile home park and rapidly went from unit to unit throughout there. There was actually a young adolescent that was alone in one of those mobile home units and dialed 911 and was able to get a operator to answer in 30 seconds. And they were able to get that person assistance, get him out, and really save that situation becoming dire. The San Diego San Diego County Sheriff credited 211 with allowing 911 to answer those emergency phone calls in that 30-second or less time period, because we were absorbing so many calls for people that were calling about, I see smoke, what should I do? But I don't see fire, things of that nature. And so it's key responsibility of 211 to be answering the 211 line during disasters, especially during fires, to make sure that our emergency resources can be deployed where necessary. This service has changed dramatically, especially about March of 2020. That we had this global pandemic that broke out. We went from taking on a normal day about 1,500 calls to taking 11,000 calls in a day around what was going on, what are the health resources. We have seen our role increase from really responding to fire disasters, to a lot of public health emergencies, to being the trusted resource to connect people to resources around county nursing, vaccinations, senior food delivery due to a lockdown situation, and most recently through 2 rain events. Earlier this year, we were activated by the Office of Emergency Service to help people during what at the time was being called Hurricane Hilary, and then of course became Tropical Storm Hilary. It was not, a huge weather event for San Diego, but a lot more precipitation than we're used to. We did not get a high amount of calls, but we did get a lot of calls earlier this year with the flooding and about the 1,000 households that were displaced in the city of San Diego due to the flooding that occurred earlier this year. And so we helped with the local assistance center. We helped connect those families specifically that were displaced and others that were impacted by that rainstorm, get connected to resources that existed specifically for them. So we play that role. We play that role with pride, and are happy to be part of the Office of Emergency Service and emergency response infrastructure in our community. Quickly, we also receive rumors or we receive feedback from the public on our 211 line during disasters. So we might have information from the Sheriff's Department or CAL FIRE or others about vetted information that's been vetted by the public officials. And then we'll get additional information from the public. They'll say, the fire has reached a certain road or the fire has jumped Interstate 15 as it did in 2007. We report that information back to what's called the Joint Information Center, which is staffed by heads of all these departments, and then they can vet that, and then we can turn it around and share it with the public. So that's a bit of who we are. I want to go a little bit through how people access our resources and a bit of that evolution that I've mentioned. I started with the organization as a consultant back in December of 2010. I've been a full-time employee now for over 10 years, just over 10 years, this week actually. And we have had 3 different, time points or 3 different almost kind of eras, if you will, in how we do service. And so going back to, who we were originally as we got the 211 designation, somebody would call 211 and it was an anonymous phone call. we wouldn't ask for the person's name. We would probably ask for where they were located in the county so that we can make sure that we were searching the right geographical area for the resources that they needed. But we wouldn't keep any record. This was almost universally the case with 211s. The idea that the call has to be confidential became the idea that the best way to keep something confidential is to keep it anonymous. And so almost all 211s across the United States were anonymous, or we based on an anonymous phone call. Where we discovered this created barriers and problems when we were trying to connect people to resources in the community was really around that. As we did follow-ups, if we called back a phone number and say, were you able to connect to the resource that you were referred to? In almost half the situations, the answer was no. And there were various reasons why that was, but you can imagine how challenging it would be if you waited on hold for a few minutes, you were able to speak to a 211 trained agent, you expressed this crisis that you might be in that moment, very emotionally in some cases, and the agent from 211 was able to refer you to an appropriate resource and give you a phone number with which to contact that resource. Maybe you transcribed a number, said it was disconnected when you tried to call them. You call 211 back immediately and say, yeah, I just spoke to somebody. And the response is, well, we don't have any record of that. So that was the way 211s operated when I first came to the organization. Everything was anonymous. We were still able to connect people to resources, but we didn't keep a record and we couldn't track over time what was going on. Now, fast forward to 2015, 2016, we decided that, you know what? Anonymous and confidential are two separate things. Yes, there's a lot of work that needs to be done to keep somebody's record confidential, but in a lot of cases, it's going to be important for us as we serve clients to understand where they've been in order to help them get to where they want to be going. And so we started creating a client record, and we actually at the same time took over what is called Community Information Exchange, which is a technology we'll talk about. It's a network and a technology which we'll talk about in another slide. But we started keeping client records. It was based on a telephone number. So if you called, we had the caller ID technology, just like everybody does on their phones, and we could create a client record. If a caller called back from that same number, we would verify their identity using tools that we have available. But then we would go into the assessment or the determination of what the stated need was of the client. We would use that information to select an appropriate resource. We have about 14 different general domains or groupings of resources that you can see on your screen, from housing to utilities, all the way down to activities of daily living, which is becoming more and more significant as we discuss the social determinants of health, employment, legal, elder care, child care, safety, disaster. Those are kind of the big buckets that we have. So we would take the stated need, we would assess, we would make a determination, and then we would make referrals based on what was necessary. Now, in this new situation where we have a client record, we can also make direct referrals. And so that has enabled us to say, we understand that your stated need is that you're looking for food and you're looking for food in Encinitas area. Well, I've got great news. The Community Resource Center is established in Encinitas. They're on 2nd Street. They have a food distribution from 11 a.m. to 2 p.m. Monday through Friday. I can set you up and I can let them know that you'll be there today. And then we send that person's information with their authorization and their consent to the nonprofit organization, along with a little bit of their story. So the reason that's significant is there's an emotional toll that we found as people talk about their distress, they talk about their crisis that they may be facing in their life, and retelling it over and over again can become cumbersome and can also delay them getting the services. So our agents are able to take the information in, create a client record, and through the Community Information Exchange, pass that on in a lot of cases to about 137 of the largest nonprofit agencies within San Diego County. We do have, as time has gone on, as we moved away from that anonymous phone call, we've been asked and we have responded to needs in our community with more mission aligned or specific demographic hotlines. And so we have taken on a role with our Section 8 housing hotline within San Diego County. So people that might be eligible for Section 8 are in the application process. We're able to check their status. We are the go-to number for that. We have a peer-to-peer veteran and active military and families of active military support line that goes beyond simply information and referral to military or veteran resources. It goes to peer support. So those are longer conversations. Those are more frequent conversations in a lot of cases, but we're able to support our active military. It's very important to us here at 211. Our CEO is an Army vet. And so we have played a role with Courage to Call for over a decade and are very proud of that work that we do with the County of San Diego and TURN Mental Health Systems. A long time support from 211 has come from First Five. First Five is a statewide program that is funded through the tobacco tax, and it is for the healthy development of children between the ages of 0, so while mothers are still pregnant, through 5, typically the time that they go to kindergarten. First Five resources includes health, so that you can get medical appointments, developmental health appointments, dental appointments for oral health. It has parenting classes for childhood development, but they're looking for healthy, mental development with children, and we are able to connect callers directly to those resources. The reason actually that we first started working with First Five was because we had such a high volume of calls from the demographic that they were trying to connect with. We actually screened and introduced callers to it. So this has been a frequent thing within 211. The state, county, a nonprofit organization knows that there's a need in our community, but people aren't finding out about it. There's a realization then that happens that says 211 is talking to, 300 to 500,000 people a year on their line. A large subset is likely our target population. 211 can, through assessments, screenings, let people know that might be eligible for these or are likely eligible for these resources to know about them. We've had a very successful, partnership with First Five, as I say, for well over 14 years. Another one was Susan G. Komen with Women's Health. We were able to connect a number of people, which helped start our health navigation line years ago. So a lot of success there. We are able to refer internally with these specialty lines as well. So somebody does a screening, we can refer directly to another agent at 211 that might be able to help with application assistance. 211 San Diego pioneered the telephonic application signature and application assistance for CalFresh, which is the SNAP benefit in the state of California. So those people that meet certain criteria and need food assistance, we are able to help them do their application, and they can do the signature on that verbally through a recorded verbal signature. And so we helped pioneer that years ago and is now the model for the entire state. We're actually the prime on the contract for 211s. So we have about 16 other 211s across the state that are subs on our contract to help people get that food assistance. We do work heavily with children through a number of these, as you can imagine. There are a lot of resources in our community that are specifically around food assistance and especially supplemental nutrition for the youth, be it through something like CalFresh, but also through the school programs and then summer food programs through the schools as well. There are health coverages that are available for families as well. So, we're experts in that, helping with them as well as that pregnancy and that perinatal care period as well. And then, one thing that impacts families is all the credits that exist. We help every year set appointments with our nonprofit partners for their tax preparations. I think you may have heard in the state of California, it said that Cal EITC, that earned income tax credit or the federal income tax credit, is the largest, in a lot of cases, one-time cash infusion that working families receive on an annual basis. So that is important. We help facilitate that with a contract with Cal EITC by setting those appointments over the phone with our callers year over year. And then, of course, there's child credits that exist in a number of tax returns as well. You can see also that we are able to, on the right, in the other referrals we offer, a number of areas that are impacting kids around the community. Again, from pregnancy to 5 years of age, to once they're in schools, after school ACEs programs, camps. We work closely with our YMCAs, summer lunch programs, immunizations, health as they develop. These are all areas where we have resources, and we're proud to help connect those families to those resources as their kids continue to develop. So I mentioned earlier that we've evolved from an anonymous, phone conversation to a client record to the community information exchange, which has brought together those large nonprofit organizations, 137 of which are connected with a client record. We will show it here in a moment, but we have about just under 400,000 lives that are consented into this database. Not only do we receive calls and are able to do direct referrals, other nonprofit agencies that interact with that individual can add to that client's record. Through that, we begin to get that longitudinal record of a client's kind of path from safety to stability to self-sufficiency. We can help identify key inflection points in areas where they might need a reach out or another conversation. And we can also add care teams to a person's profile. So if we know that somebody works down the street from us at Jewish Family Services, we can add a social worker or an employee there to that care team with the client's consent. And then if something occurs, that person would be notified as part of that care team. And so we're taking advantage of the digital tools that exist to make it more efficient to deliver these resources to the community that we live in. So traditional, just quickly, by way of explanation, that direct referral is an electronic referral that would show up directly at the organization in their system, in the shared platform that we have, or into their natural casework system that they utilize. So we're able to take it from our implementation, which is based off of Salesforce, and we can send it into other systems, or we also share our Salesforce instance with a number of nonprofits through that. We're able to keep those, utilize that, as well as provide the client with information about where the referral is going via text message. But this is in lieu of simply informing an individual that might be calling of a phone number that they should call. We're trying to close that loop as well to make sure that we're getting the feedback when we make a referral, that the person has accepted the referral and that it was successful. The organization was successful in contacting the individual. So CIE, the Community Information Exchange, really is that arm from our organization where, we are able to share directly with our nonprofit organizations. Part of the idea behind it originally was people that call 211 probably also utilize other resources in our community, like the YMCA or Interfaith Community Services, Jewish Family Services, Father Joe's Village, PATH. All those organizations, if we had a shared database, we could get more information about the clients that were being served if we had information that they consented us to use in a searchable database. And so nonprofits, as we reach out or we work with individuals, will search to see if there's information about the individual's prior history in the Community Information Exchange database. And then we can, in some cases, effectively utilize resources in the community as a one-stop shop for signing on or signing in for resources. An example of that was during COVID. Each shelter that was provided for homeless resources had their own list. In some cases, it was as elementary as this is how many beds we have. It's a first come, first serve. This was getting in the way of being able to direct people to the most appropriate referral for their need. And so we utilized the Community Information Exchange as a homelessness prevention resource where we could not only share screening, but we could prioritize the resource and actually hold a bed for somebody that we were working with. Now we're moving into a situation, as I mentioned, this idea of social determinants of health, the impact of somebody's living situation or food situation having an impact on their physical well-being. We're able to connect the referrals directly to our healthcare community. So if a clinician sees something in a patient that is not going to be solved with pharmaceuticals, isn't going to be solved necessarily with maybe lifestyle changes, isn't a medical intervention, but is a lifestyle intervention opportunity, they can make those referrals directly to a nonprofit partner. We have a smoking cessation program, which would be a key case for that. But we also have the idea of somebody that has housing stability issues that is impacting their health, utilizing like the emergency room as their primary care physician. We can start to help assess that and hopefully find a resource appropriate to work with. And then finally, as I mentioned just a moment ago, the idea of alerts or a proactive response. If an inflection point or something comes up with a client, we can add different nonprofit users as care teams so they would receive that direct alert. So that's really the service that we're providing as a 211. That's how we're leveraging technology to bring together a number of different organizations. But then just quickly want to close with the idea of how does 211 connect with people, and how do we make people aware of the 211 services? So we certainly go out in our community. We bring our community into our organization as well. We provide tours. We meet with elected officials. We're part of news events at various times. Cool Zones just started up. We typically held a press release with various electeds, SDG&E, to go over the importance of the Cool Zone. So that's one example of different publicity that we use. We go out to fairs that go on in parts of the community where we believe 211 would be a benefit, so that we're out not just on the phone, but people can see us. We were a part of, as I mentioned, the local area assistance centers, the various libraries when the flooding occurred. And so we are helpful with that. And then finally, we partner with various emergency services, be it the police department or the fire department, with cards that can be handed out. So if a first responder sees something going on that they're not going to be able to address in their interaction with an individual, they can help them by giving them 211 card. We have about 1,250 nonprofit partners that are in our resource database. So 1,250 nonprofits exist in our county. They're a great source of referrals to us, because a lot of times an individual will have a relationship with a nonprofit, but one nonprofit doesn't do everything. And so, they will say, you need to call 211. As was mentioned by Jay in my introduction, I'm involved with the YMCA up in North County and Encinitas. That was a situation that we had there where YMCA employee referred another employee to 211 when it was discovered that employee was surf couching, or couch surfing, as they say. He didn't have a permanent address, was really utilizing friends to find sleeping places. And so, that was a referral that came from the YMCA to 211. We find out a lot of people find out about us that way. Of those 1,250 nonprofit organizations, they provide about 5,600 different services. So nearly 6,000 different services that would fall into those 14 domains that I mentioned. A lot of our referrals are going to our CIE partners, just because they're the largest, nonprofit organizations. They have the largest capacity and they have the most services. So as I mentioned, it's 137 organizations connected to our CIE network that we can give those referrals to, and just about 350,000 individuals in our community. So over 10% are consented, over 10% of the population of San Diego County is consented into our community information exchange. So that is how we're kind of moving forward, and that's how we connect with various people. In conclusion, we want to be a resource. We want to be a resource for you as you come in contact with people that are in need and don't know necessarily how to assist. We would love to, assess and partner and work with people to connect them to the resources that are available in the community. We keep our database up to date, frequently interacting with nonprofit organizations, those 1250 nonprofit organizations. They have access to their profiles, so they're making updates on their hours of operations and their other key data information on our database. But we're out in the community working with them as well. And so, we're going out talking to those partners, making sure that we have what is important to make sure that we can give accurate referrals as we deal with individuals or people refer through our database. If at any point, you have interaction with 211 or you use our resource database and you find that something's off, we always welcome that feedback at our info@211sandiego.org email address. This is my contact information and a little bit of information, QR code for our newsletter to stay informed about what all is going on. With that, I will stop sharing.
Thanks, Paul. Wow. Lots of great information. I know we had a couple of questions, excuse me, from the audience. If you are unable to unmute, go ahead and pop your question in the chat and we'll make sure Paul gets a chance to address it. But I did see one hand up, and I don't believe Claudia is your actual name, but did you have a question? Someone from our Tierra Santa Club?
No, I did not have a question at this time. I was reaching for something.
Okay, awesome. Just wanted to check. I saw a hand floating over a camera, so.
But while I'm on, do you connect with, I know the Catholic Church is, has been pushing to have their different parishes throughout the county set up care programs for people that have, especially those that are like terminally ill or have end-of-life issues or excessive care issues. It's called Caring for the Whole Person. And that's being started out of the Diocese of San Diego. And, I don't know how aware they are of, they should be, of all the 211 services, but that'll be a great reference. And I don't know if you'd like to contact them and let them know, what you have going on so they can spread that information efficiently.
Yes, absolutely. We are in contact with Catholic Charities, obviously like Father Joe's Village, some of the dioceses, but we'll make sure that we have that information as well and that relationship is there.
We have a question from Gordon Borner.
Hey, Paul, quick question just for context. I mean, boy, I'll tell you, I probably wasn't the only one that cringed when you mentioned 11,000 calls in a day. I mean, that must have just been a tsunami. What kind of hold times? I mean, how'd you guys deal with that?
Yeah, that's great. Great question. And so during times of disaster, and certainly during times where there's a lot of public uncertainty around what one should do, like we all experienced to a certain extent in March of 2020, I like to say 211 is only as good as the resources that exist. And so, during that time, there wasn't great information and there weren't a large quantity of resources. It was just a lot of unknown. And so our number was flashed across news channels as a place to call for information, but we don't make the information, right? We need we need the governor, or we need the mayor, or we need the supervisors to say, this is how we're responding to this brand new thing for everybody. And so we utilize our technology, our phone technology, to try to address pre-recorded messages where we know that we don't have a specific resource for an individual that may be calling. So as a smaller example, maybe, we're all aware this has been a very hot summer. There's inclement weather resources that are activated for the desert regions of San Diego County today. If you were to call to say, I need cooling resources, I need to get out of the heat, our phone technology, before you spoke to an agent, would say, what zip code are you in? If you entered a 5-digit zip code on your phone that had a resource, we would connect you to an agent. If you didn't, we would give you a pre-recorded message that's saying at this time, there's not inclement weather services available. So on the day when we had 11,000 calls, yes, very challenging day. But what we did immediately was a number of things. We changed the phone technology so that we could defray individuals that just wanted any information that was available for all the public, and they could get that pre-recorded information. So they didn't need to talk to an agent to get that. We partnered with the County of San Diego to say, you know what, we need the public health nurses to start assisting people with public health issues, because we are social workers, some social workers, but we're working in the social spaces, not the health space. And so we had a great partnership with the county over those 3 years with the public health nurses. And so we utilize the 211 dialing code to phone a friend, if you will, where we know that there are experts in an area that can start taking the phone calls with their areas of expertise. And so that's how we divert phone calls from our agents that are great at what they do, but we don't do everything.
Yeah, that makes sense from a triage standpoint. Thank you for clarifying.
Wow. Well, thanks again, Paul. I know from all of us, thanks for sharing, and thanks for all that you do and your team does. You're welcome to stick around. We've got a few more minutes of kind of club business, but if you need to be on your way, that's fine as well.
I appreciate it very much, Steve. Thank you very much, Kiwanis. It was great speaking with y'all. Please utilize my contact information if you have any follow-ups. Again, thank you.
And Paul, before you go, I didn't want to ask this, so I won't ask it, but Judith, if you can put up the slide really quick. There's got to be a story behind what we see in the slide here, the Paul Redfern.
Wait, wait, let me, hold on.
I mean, you don't have to answer this, but I'm just saying there has to be a story behind what the image we see on the screen and the live image that we see here. But we don't. I'm not asking. That's all.
I was invited to participate in a triathlon in May, and I found that the drag from my locks were too much, so we had to lose the hair.
So did you complete it in record time? Can you at least tell us?
It was my first half Ironman, and so it was a record for me. It wasn't everything that I wanted, so I signed up for Oceanside in 2024. So
awesome.
Or 2025. So I'll be doing another one.
Awesome. Cool. Well, that's a good story. Thanks for sharing that, and thanks for all you do, Paul.
All right. Thank you. Bye.
Thank you all.
Take care. Okay, we have one other guest to introduce very briefly. Kristen, if you're on the line, if you could go ahead and unmute and just say hello from Nativity Prep Academy.
Yes, I am here. Hi, everyone. Thank you for having me. I know I just have a quick minute, so I'll be as brief as possible. My name is Kristen Haygood. I'm the Director of Advancement at Nativity Prep Academy in San Diego. We are a middle school and college access program for low-income first-generation college-bound students. So we serve San Diego County, and students come to us in 6th grade for middle school. So you can see on this chart here, they're with us for 3 years in middle school, 4 years in high school, and then 4 years in college. So we provide support for 11 years. We have a variety of different programs, but one of the things that's special about us is we provide graduate support. So starting in 6th grade, we start talking about college. We start talking about high school applications, financial aid. So it's really a college mindset all the way from 6th grade to college graduation. And what we're doing is we're preparing our students not only to be accepted to college, but to excel and to graduate. So what we found over the past 10 years is our students are 5 times more likely to graduate than the national average, which is pretty remarkable when you think of our population. So I'm here today just to kind of tell you a little bit about Nativity. We're always looking for volunteers. We have a mentor program where our middle school students are partnered with an adult for 1 hour a week. They have lunch and do different activities together. So something to throw out to this group, but we're always looking for tutors, people to come as career speakers. So if you are interested in learning more about Nativity, Judith can give you my contact information, or you can look at our website, nativityprep.org, for more information. Any
Awesome.
quick questions? I know I only have a minute. I was told 1 to 2 minutes. It's a
Thank you.
large program to try and condense down to 1 minute.
No, that's okay. Thank you, Kristen. Appreciate it. And yes, Judith can connect you with our community service team because we try to plan a community service event every month for our team to get out
Perfect.
and support. So
Yeah,
thanks
and
for
if
being
anyone
here.
wants to come for a tour, we're always welcome. You're welcome to come join us. So hope to see some of you soon.
Awesome. Thank you,
All right,
Kristen.
thank you.
Okay, and we do have one birthday this month, and she happens
And
to be
she's here.
on the call. I know she said she was unable to show us her video today, so don't worry, Brittany, we're not going to embarrass you. However, if you'd like to consider making a contribution to the club in lieu of your anniversary of life, let Judith know, and she can help broker that. In that spirit, that same spirit, does anybody have any good news to share, happy or sad dollars following Bills Bucks? I don't know if we have any fines. I do not have any fines to dole out. We'll have a in-person luncheon in a couple of weeks where I'm sure we'll have some fines as well. There we go. Nice smile emoji from Brittany. But any Bills Bucks, any happy or sad dollars in the last few minutes of our luncheon today?
Sure, I'll put in $20. It was for not one playhouse did we build last Saturday, 2 playhouses with Habitat for Humanity. It was a really, really great service project. It's warmed up my hand for the painting for the house build. Karen and I are already plotting like bringing 20,000 paintbrushes, but it was a really fun day. The Academy of Our Lady of Peace Key Club was present with their amazing advisor, and the girls, and with Gordon and Karen and Harrison had one house, and the rest of us had the other, which Eric Weaver brought his son, and Emily Moberly brought her 2 daughters, which one of the daughters immediately attached herself to the teenagers, rightly so, much better vibes, and then left Emily and I to power tools. Shocking that we both have our eyes and all of our fingers right now. But it was a really, really great day. Habitat Humanity did a great job organizing it. They were very hands-on, and we had a really great time. Tracy Knight, also kudos to her. Having her at service projects, being the boss that she is just amazing. So it was a really great day. I left with my heart full. And what I love is that, if you didn't remember, it was one of our Habitat for Humanity was one of our community impact grant recipients, and they received $25,000 from us to build 57 of these playhouses that are being spread out all across San Diego. One, if you ever tour the Children's Discovery Museum in Escondido, they have one there, and they all are stamped with our Kiwanis logo, which was really cool to see them all lined up and getting ready to go spread some love. Let's pray none of the kids end up with nails in their fingers. But we're doing a great job trying to spread some love and get kids back into playing and off the phones and off their butts and back into imaginative world that they all belong in. So it was a great day, and I just wanted to throw $20 in the pot for that and thank everyone that was involved.
Awesome. Gordon.
Well, I was going to go with the same pathway, but Karina nailed 99% of everything I was going to say. The only thing that I didn't see checked off on my box was the 2 houses are going to 2 military families, for enlisted military families. Other than that, Karina did an amazing job of checking the other 15 parts of the amazing day. The only other thing, just to justify my $20 that Judith's going to bill me now, thank you, Judith, is announcing the pleasure of having JD Wicker, athletic director at San Diego State, get Brian Dutcher recruited for our October 15th soiree. So we'll look forward to our Tierra Santa folks who might be SDSU alums joining us on October 15th at Elijah's.
Yeah, big year for San Diego State fans. If you weren't with us in March, we had Coach Lewis, who was just hired as the new football coach, and then now we've got Dutch. So that's it's a pretty good year for you Aztecs out there. So
How appropriate that our new president, it's his first in-person meeting, and he is alum of San Diego State. So it all is just coming together very nicely.
I know, unfortunately for Justin, you can only go down from having Dutcher, so the rest of his term is just going to be rough, but he'll start off with a bang, so that's good.
I don't appreciate the lack of confidence in the programs team, which rocks. So we're setting the bar high, and we're going to keep going for that kind of level throughout the year. So just wait and see. I hope you'll be swallowing your words come the new year, Steve.
I'll be impressed. If they get Mike Schilt or any of the head Padres brass, that'd be good too. Anybody else for Bills Bucks before we wrap up? Okay, so we did have some events this last month. As Karina mentioned, the August 3rd was the Playhouse build, so that just happened over the weekend. And before that, we had a few members of our board and foundation board attend the San Diego Foundation Scholarship Breakfast. So some of the scholars that we support were in attendance there. You can see that nice photo. We also had the DCM meeting back in July. And gosh, if you can think all the way back to July 16th, we had another service project. So lots of service and community efforts happening. Oh, that was our luncheon. Sorry, that was our Safari Park San Diego Zoo author who was there, Georgianne Irvine, back on the 16th. And then, as usual, we'll wrap up with our list of upcoming events. So next week we have our networking night, our monthly networking night at the Malibu Farm in Seaport Village. If you haven't been down there in a while, great time to check that out. And then we're back at Elijah's the following week for an in-person luncheon on the 20th of August. And then we have, oh yeah, if you're not involved, if you haven't heard about the Bay to Park Paseo project, there's an opportunity to tour that section on the 7th, and this is now jumping into September. And then also another service project happening. Since we did our service project in early August, we'll do our next service project in September, working with the Walk in Remembrance with Hope. So you can scan the QR code or go to our website and click on the events tab to check these out, sign up. We'd love to see you at a future event. And with 1 minute to spare, it was good to see all of you, and enjoy the rest of your week.